Medical experts and government representatives are raising fresh concerns over the rise in consumption of sodium in Nigeria, linking it directly to the growing burden of non-communicable diseases, especially cardiovascular conditions. These concerns are highlighted at a one-day journalism training organized by Corporate Accountability and Public Participation Africa (CAPA) on salt reduction in front of pack labeling in Nigeria, with support from Global Health Advocacy Incubator. The training equips journalists and media practitioners with the knowledge and tools needed to effectively report on and advocate for policies that promote healthier food environments in Nigeria. Participants are also exposed to key issues including salt reduction, front of pack labeling, and nutrient profile models, all of which play critical roles in advancing healthy food policy advocacy. These experts at this training highlight the dangers associated with excessive salt intake, stressing that foods high in sodium, including seasoning cubes and processed foods, must be drastically reduced. They identify high sodium consumption as a major contributor to stroke, hypertension, cancer, and diabetes.
Sodium is a food additive that the government has looked to reduce the burden of non-communicable diseases, especially cardiovascular diseases in Nigeria. This is because sodium has been found to be the leading cause of hypertension, which also leads to stroke and other cardiovascular diseases in the country. So we know that sodium, which is a part of salt, comes in various forms and then it's in different types of foods or different food categories. So including bread, noodles, our seasoning cubes, or even spices that we add into our food.
Global move, and this stems out from the fact that we are now faced with a silent pandemic of non-communicable diseases. And non-communicable diseases currently accounts for 75% of deaths globally. It is the number one cause of death in Nigeria as well. And the unfortunate thing is that low and middle income countries, Nigeria inclusive, suffer the heaviest burden of the diseases associated with, intake of unhealthy food. The death that comes out, as a consequence of it, and disability as well. We do not even have the wherewithal to address basic health concerns because of, the realities of.
On the way forward, stakeholders call for a whole-of-society approach, urging increased awareness and sustained public education to drive behavioral change among Nigerians. They also call on government at all levels to formulate and implement healthy food policies that promote better nutrition and support healthy living.
So considering the pivotal role that the media plays in public sensitization, public education and advocacy, it's pertinent to help journalists understand topical issues around healthy food policies in Nigeria. And the healthy food policies I'm referring to are mandatory salt targets, front of pack labels, sugar sweetened beverage tax, amongst other.
So that's why we're here today. You are very critical players in that struggle. How you report the food environment, how you investigate, how you also, prompt the government to do what it has to do in terms of implementing and enforcing policies that protect the lives of people is going to go a long way in also just causing that ripple effect that will protect society. So today you learn about the tactics that corporations apply when they want to promote, advertise, or push unhealthy diets into the environment, and so that people just consume without knowing what they're taking in. Today you'll also learn what currently exists in terms of our policies regulations, what the government is doing. It's a good thing the Federal Ministry of Health and Social Welfare is here. We have Dr. Jerome Afeni, very...
At the training, journalists learn about the marketing tactics used by food companies to promote their products. Experts call on manufacturers to adopt transparent labeling practices by clearly stating the levels of salt, sugar, fat, and oil in their products, enabling consumers to make informed and healthier choices. They, however, stress that all stakeholders, including government, health professionals, and food manufacturers and the media, must work together to drive advocacy and reduce sodium consumption nationwide. Adenike Oweye Ajiboye, Superscreen News.